of tech troubles today, and I'm on different computers with different headphones, so please be kind. I'm just going to share the screen quick. Okay, so first of all, thank you so much for inviting me to speak here today. My presentation, as was mentioned, should be between 20 and 25 minutes. And the objective is to bring attention to the value in collecting local, particularly local rural data that can be used to develop response plans, to support efforts to secure and advocate for additional services, but ultimately to increase the resiliency of small and rural communities across Canada. As mentioned, I'm going to draw from an ongoing research project that has been collecting data from 2 rural counties, Perth and Huron, on the experiences of residents to the ongoing COVID-19 pandemic. First, a little bit about my background. I'm born and raised in a small town. I was brought up in Corbeil, which is just outside of North Bay. I was bused to school. I had a mailbox. I was definitely a rural country kid. And while North Bay itself is not necessarily a small community, it has about 50,000 residents. Northern Ontario communities experience many of the same limitations and concerns that small rural communities do. Typically older residents, primary resource dependence, and isolation, digital, service, and physical. And after about a 7-year stint working at the University of Alberta, we moved back to Ontario and settled in Fergus. My master's was an examination of environmental management techniques and the need to realize that a one-size-fits-all model doesn't work in rural Ontario. My PhD examined siting decisions and policy implications of landfills in Canada with a focus on rural Nova Scotia, how impacts are experienced and felt by rural local populations. And I'm currently, as mentioned, a faculty member in the Rural Planning and Development Program at the University of Guelph. I'm a research chair with Gateway Center of Excellence, as well as I specialize in rural research methods, rural and community resiliency, and then transformative resiliency. So in the last 5 minutes, I've said the word rural probably more times than you might have heard over the last week or even month. So a big question is, why rural? Ultimately, because rural places and small communities have been neglected. This neglect is a symptom of politics, of voting seats, and of population. 82% of Canadians live in non-rural locations. That means about 8.3 million of us live in rural places, small communities. That being said, the vast majority of policy decisions are based on the experiences of those 82%. I, for one, think it's critical that everyone should be able to see themselves in policy, not simply urban Canadians. Why? Because rural places are different, not because they are better and not because they are special, simply because they are different. Our demographics are different. We often have a greater percentage of older residents, so ideas around, concerns around mobility are critical. We're isolated digitally. We have lack of broadband service. We have lack or insufficient medical specialists, and of course, physical isolation. COVID has brought attention to the implications of these factors on the mental health of all Canadians, but the experiences of rural Canadians are unique. So, kind of the crux of today's talk, why local rural data? And I can imagine that many of us have heard this saying, if you've been to one rural place, you've been to one rural place. I do not subscribe to this. There are commonalities between rural places, but it's important to recognize that each has local nuances. Rural is not a monolith. Rural is not only agriculture, it's so much more. Farming is important, but so are the small artisan shops, the butchers, the plumbers, and the rural schools. We as rural Canadians need to have our voice heard, and the best way to get that voice out there is through reliable, valid data collection. We need to ensure that our opinions are heard and that they're relevant. This process legitimizes our concerns by engaging with local populations. That way there's an increased sense of buy-in or ownership from those local communities. So as I said, I'm drawing from one specific project, and the goal of that project was to explore the experiences of residents from across Perth and Huron counties related to the ongoing COVID-19 pandemic to highlight the value of collecting local data. In consultation with the research team and an advisory group, 5 objectives were developed that are listed there on your screen. And it's critical to note that on that advisory team were local residents, representatives of the NGO and charitable sector, local government officials, local health unit employees, and as well as local businesses. Additionally, I reached out to each and every organization that would talk to me: social services, Ontario Works, immigration groups, economic development, agricultural producers, and so forth. The idea was to ensure that these objectives resonated, not only with the case study areas, but to make sure they resonated and reflected the interests of the community members that live there. So today I'm going to present data that was gathered using a quantitative survey. The survey had 5 focus areas. The first was demographics. I wanted to be able to present data to a social service agency, for example, that focused on food security. So I wanted to be able to say to them, here are the experiences of participants that self-identified as female, that were under the ages of 30, those that made less than 40,000, worked in the service industry and rented their homes. I wanted that level of granularity. The second section pulled from the Canadian Index of Well-Being, indicators like physical health, mental health, finances, and so forth. They're listed there on your screen. The third phase was social behavior. This is all about economics, all about economic development. How do we move? How do we shop? For example, Stratford is a community that is heavily reliant on tourists and the festival. COVID has changed our movement. It's then critical that relevant, reliable economic data is collected and shared with various Chamber of Commerce, various economic development departments to enable proper support to be identified. The reality is we have changed and we will not go back to the way we were. And local businesses need to have access to data that helps them understand what needs to be done. The fourth section was on day-to-day living. In a nutshell, anxiety. What are residents concerned about? Personal health, finances, ability to keep food, medications in the house, and so on. And then lastly, planning and prep. What are we doing in terms of emergency planning? There is no need to duplicate something if it's already being done appropriately. I asked each section 3 times. We asked participants to reflect on life before the start of the pandemic, then to go through them again since the start of the pandemic, and then to imagine life after the pandemic. We wanted to be able to paint a picture of how things have changed and how things might look in the future. Each survey had just over 120 questions, and we received just shy of 3,600 complete surveys. So as a quick overview of who participated, the largest single age bracket were individuals between the ages of 60 and 67. This is nearly identical to the age brackets according to Statistics Canada for that region. And this is really, really important because it allows us to say with statistical significance and confidence that our data is legitimate and it's representative of StatsCan data. I like to highlight also education attainment, which is there on your screen. 75% of our respondents indicated that they had some level of post-secondary education attainment, nearly 10% higher than the national average. I highlight this for a couple of reasons, but the big one is the attempt to stop or halt the stereotype of rural residents as poorly educated or simple folks. Our data indicates that this is a group of Canadians with a higher than national average of education attainment, and it's really critical that that stereotype is broken down. One of the most important areas that rural places differ from their urban counterparts is where people work. While healthcare and social services are the largest single cohort, agriculture is the second highest. Agriculture isn't so much of a job as a vocation. Individuals in this sector cannot simply close the barn door, so to speak, at the end of the day. There's a need to recognize that their workday is simply much different than that of someone who works in an office tower in downtown Toronto. Services that support that group of individuals, that work schedule is critical and it must reflect their reality. Now let's get into some of the data. As I mentioned, participants were asked to assess their well-being using the CIW indicators. Here are the responses for prior to the pandemic, and here are the responses for after the pandemic. No numbers, just trends. Anyone can see the increase in values on the right part of the scale there. So if you look here, an increase in average, satisfactory, and poor. These are simply like the bad values. The columns on the far right are reflective of 2 particular questions: satisfaction around employment and satisfaction around retirement. And you can assume that group of people don't qualify for one of those questions. Now let's get into some more mental health stuff. Without getting into any numbers yet, I'm just trying to produce and show some trends. What we're looking at here is self-assessed mental health of respondents before and after the start of the pandemic, which we said was March 1st, 2020, just for a simple date. What you can see is a significant decrease in mental health, or more specifically, there was a 45% decrease in participants who self-assessed their mental health as excellent after the start of the pandemic. Again, a 45% decrease in participants who self-assessed their mental health as excellent after the start of the pandemic. There was a 26% decrease in participants who self-assessed their mental health as good after the start of the pandemic. And then we started seeing some really concerning trends, a 32% increase in participants who self-assessed their mental health as average, a 57% increase in participants who self-reported their mental health as satisfactory, and kind of a shocking or remarkable 79% increase in participants who self-assessed their mental health as poor since the start of the pandemic. As many of you understand, sex is the most important indicator of vulnerability in most instances. Women simply are more precariously employed, they are more responsible for home and for childcare, and generally they are paid less than their male counterparts. This slide is illustrating the difference in self-reported mental health by self-identifying sex. There was a 42% decrease in self-identifying females who indicated or assessed their mental health as excellent, so a 42% decrease, and a 5% decrease in males. A 60% decrease in self-identifying females who self-assessed their mental health as good after the start of the pandemic, and a 51% decrease in males. And then a 68% increase in females who indicated their mental health as satisfactory. And now we're starting to see a bigger shift here, a 70% in self-identifying males who indicated a satisfactory mental health. And then if we go all the way to the end, we saw a 67% increase in self-identifying females who self-assessed their mental health as poor, and a concerning 72% increase in males who self-identified, who recognize their mental health as poor. So sex is a statistically significant indicator of the impact of COVID-19 on mental health. Now, we wanted to try to do some tie-ins about mental health and income. So what you're looking at now is mental health before and after. And we kind of initially expected this to be a very significant finding. Unfortunately, maybe not, maybe unfortunately, it is not as significant as we thought. If we were to break it down, the number seems to be more reflective or more impacted as soon as someone indicates they make less than $50,000. Income is really difficult to get to because if you ask most people in a house, even though we asked for individual data, you typically respond on behalf of your household when it comes to income levels. So this is kind of with a caveat. We are not really sure if this is actually individual data or household level data, but it wasn't as strong as we initially thought. But what we wanted to know is, what if we add another layer of analysis in here and we look at mental health by sex, before and after, by income? So if we just look at females, and what we can say here is there was a statistically significant relationship when you tie on females. So what we can assume, if we go back to that first, one of the first slides I showed about the impact of sex, it is exacerbated, sex exacerbates the impact of income. So a female who makes less money than a male counterpart has been disproportionately impacted by COVID. Their mental health has been disproportionately impacted. Again, reinforcing that unfortunate realistic idea that females have been impacted by COVID more than their male counterparts. Here is the data for male, and I want to make it clear that while it is more statistically significant for females, it is also statistically significant for males. It's simply that the numbers are more drastic when we look at the female respondents. We haven't done any qualifying or qualitative questions yet, but we can assume there's a few things that are long understood in the academic literature. Females, especially rural females, are more comfortable talking about things like mental health. Men in rural areas continue to sweep things under the carpet. They don't open up the way that females do and the way that they should. So we want to tease that type of information out in a little when we get into the qualitative component. Now, then we wanted to look at mental health by age. We originally thought that this might be significant, and it simply wasn't as statistically significant as we thought it would be. That being said, young respondents have been disproportionately impacted according to their responses by COVID than the older cohorts. Specifically, individuals who participated under the age of 40, even more so under the age of 30. Under the age of 30 in particular, the numbers were very, very significant, over an 80% increase in participants who said they had poor mental health under the age of 30. So what we're really interested in teasing this out a little bit more, because in that group of under 30, they still may be students. I can see some of my own students on this call, so they fall in that group. You also typically in that age group, maybe you are purchasing your first house or realizing given the housing market that you cannot purchase your first house. And then of course, young parents and so forth. So there are some natural anxiety inducing events in that cohort, but they all have been exacerbated by COVID. Then we wanted to go a little bit more. What about females by age, before and after? And the reality is young females under the age of 30 have been very, very significantly impacted. A 95% decrease in females who self-assess their mental health as excellent, and an increase of nearly 80% of females or self-identifying females between the ages of 18 and 29 who self-assess their mental health as poor. I bring this up because we have spent a lot of time, the government has spent a lot of time focusing on seniors, and physical ramifications of COVID for seniors is very, very significant. But it is critical that young Canadians, young females in particular, are not neglected. Our data indicates that that cohort in particular has been very, very, very significantly impacted by the pandemic. This again is just the male side, and the data is also very significant. However, the significance of the female side is more drastic. However, it is statistically still significant for this cohort. And this is just going even more. So if I focus on that 18 to 39, just to really tease it out a little bit more, what you're seeing here is that 76% decrease in self-identifying females who self-report their mental health as excellent, a 50% decrease in the good category, and then a 60% increase in self-identifying females under the age of 30, or under the age of 40 rather, who report their mental health as satisfactory, and a concerning 87% increase in self-identifying females who report their mental health since the start of the pandemic as poor. Oh, sorry. So what you're seeing here is, I've already presented quite a bit of data, and I mean, I have to admit, I love statistical numerical data. I find it really interesting. So what I wanted to do here is say, first of all, I had 3,600 completed surveys and kind of limitless plays for where I can go with this data. And I have focused on mental health because I personally think it's just something that's super critical that needs to be addressed as soon as possible. And I have so much more data around economics or physical health or retirement or housing and so forth. But I kind of wanted to bring this all back to why I'm talking about this, the importance of local data, collecting local rural data. So this is what you can get from StatsCan on the two areas. You can see Perth and Huron on the two columns there with a whole mess of different characteristics that Statistics Canada asks about. And the reality is this data, while it's interesting and while it's important, and I really think Statistics Canada is they serve a critical role, this data is old. Our last census was 2016. This data is not granular. For example, you see Perth there. Stratford is part of Perth. And I think everyone on this call recognizes that accessibility concerns within the city of Stratford are simply different than individuals who live in the rural areas of North Perth. However, in this chart, they have been kind of clumped together as one group. This continues for each section, whether you're looking at employment sectors or age or income. This data is good, but the question that should be asked is, do you want to base policies and policy decisions that impact local residents on this data? I would argue that it's critical and crucial to gather as much local granular data as possible to make sure that the policies that are being developed make the most sense for the populations that they impact. So one of the first slides that I presented was why rural data matters. And I included each one of those words that you see there, but sometimes pictures help. As I said, Rural is not a monolith. There are local nuances that simply must be included. They must be considered when policy is being developed, when response plans are being developed. Because what the people of Ottawa need, what the people of Vancouver need, is not the same of what the people of Goderich or what the people of Listaville or what the people of Fergus need. Data has to be relevant so that the policies that are developed reflect the needs of the people they impact. And then lastly, it's important to say I'm not an advocate. I'm a data scientist, I'm a researcher, but I am not an advocate. I do collect data that can help people advocate. Our data has already impacted local areas by securing funding for increased ambulatory care. We've presented the data in a way to help areas obtain increased mental health supports, as well as we've identified critical gaps in the local system. Local councillors have passed motions and the needs of local residents have been highlighted. So far, I think I've given about 30 presentations, maybe a dozen interviews on the radio, but the thread that weaves across each is that rural places and small communities and the people who live there matter. Their experience matters, and what response plans, and when response plans are being funded, when response plans are being developed, it's critical that their voices are the ones that impact and influence what goes into those plans. Oops, I don't know why I did that, but that's the end of my formal presentation. There's been a ton of people involved in this program or in this project so far. You can see some of the graduate research assistants listed there, as well as part of the advisory committee members. There's my contact information. And then we've received funding from a number of different areas from across the nonprofit and charitable sector to local governments, all the way up to the provincial government. Thank you very much for your attention, and I'm happy to take any questions at this time.
You're muted, Norm.
Norm, you're muted.
Yes,
sorry about that.
Yeah, no, thanks. I'm that's not the first time that's happened.
Oh, I know.
Anyway, thank you for the presentation. That was excellent. And I have some, pre-prepared questions, just a couple of easy questions, I think, that feed into your findings, and that while I'm asking those, it might give people a chance to type their own questions in the chat. There's one question there already, so we'll see if we get some more. But I think to start off, you did this sort of work in Huron Perth relatively early in the COVID-19 experience. So sort of two questions that come out of that for me. The first is, if you did the research again, would you be able to find the exact same respondents to your study? Like, do you have that information when they submitted, or?
So I have the survey was delivered in two primary ways. I just didn't have time to go over all of this.
Yeah.
Originally, it was going to be a completely digital survey that was delivered using Qualtrics as a statistical package to help me gather the information. And then the County of Huron and the town of St. Mary's really thought this data was important. So they funded a residential paper mail out. So every household in those two areas got a paper version of the survey. So if it is a digital survey, yes, I can say by IP address who completed it. If it's a paper survey, obviously I cannot. Everything was confidential. The caveat being, I did ask if you would be willing to participate in a follow-up qualitative interview. So we had roughly 3,600 surveys completed. 1,759 people said that they would do an interview with me. So we have a huge response rate for potential interviews, and I haven't done the interviews yet, simply because I'm waiting for the vaccination, for a critical mass of vaccinations to be delivered.
Right. Okay. So supplemental to that, I guess, is that this kind of information, how relevant is it to other crisis response? Flooding, blackouts, fires, whatever kind of scenario that might be experienced in a rural setting.
Well, I mean, part of your initial question was about the time in which this was done. So this was done in the fall of 2020.
Yeah.
And I mean, if you just talk, everybody's having these conversations, it's inevitable. So we keep saying, this is never going to end. This is never going to end. However, if you compare the element of this is never going to end back in September to January or February or March, as our numbers have continued to increase, as fatalities have increased, as variants have increased, the only thing I can assume is it's worse. Small businesses that were hanging on, hoping for a good Christmas, they got quite honestly slaughtered by the Christmas season because we couldn't get out there. People right now are desperately hoping for a good summer, not just individually hoping to get out, but also it's so critical for Canadian small businesses this summer season because it is when most people are able to get out. So I think those are some of the big concerns for the data, and it is a snapshot data. But in terms of your second question about applicability to other disruptions, I think there's a lot to be learned about how people respond to disruption. And I think the reality is something like climate change or something like a political change does impact people in different ways. In rural places, simply because of demographics or access, they react and they respond in a different way. They don't have the built-in, critical mass the way that a larger service center does to be able to withstand it. So what I mean more specifically is, we all have heard representatives of various levels of government coming out and saying, we're doing everything we can for small businesses. And if you own a local restaurant, we'll do everything for you to get on to have a great website. We encourage you to use things like DoorDash or Uber Eats. I mean, I live in Fergus, which isn't that small of a rural place. And we don't have any of those services. That's just not something that we have. And so I think the lesson here is that this shotgun one size fits all, regardless of what the disruption is, doesn't always fit uniformly given the diversity of our towns and our communities and the people that live there. And so regardless of what the disruption is, it's important that a little bit of time is taken to make sure that what is being suggested that residents, that business owners do is actually A, possible, and B, reflective of what the people and the residents of those communities can do and need to do.
Right. Okay. So you mentioned some sectors. You showed some sectors and things like that. Mm-hmm. And I think you've just actually answered this question. It was about the implications for economic development. I think you just talked about that. So maybe I can just move along to the question about your expansion of your work. Like if you did this in Huron and Perth, you're doing it elsewhere, I understand.
Yep.
And if there's other places interested in having this data for their own region, how do they link up with your work?
So when this all started, Norm, quite honestly, people, including good friends of mine, were just like, you're making a terrible mistake to run a survey, A, right now, and B, at all. People are surveyed, they've got survey fatigue, they're tired of this, you're never going to get a response rate. And I thought, yeah, you might be right, but no use and no harm in trying. Quite obviously, rural people, I hit a bit of a nerve here. People are very interested in this topic. So our response rate was sort of bananas, way more than we ever thought it was going to be. And because of that, I have made presentations to organizations like the Rural Ontario Municipalities, so ROMA. I've talked to OMAFRA, I've talked to all of these different organizations. And what has happened is I've secured about $240,000 from OMAFRA to expand the project across rural Ontario. That funds only about 6 counties because of the cost of mail. So a good chunk of that money would go towards graduate students, because obviously my job is training and to make sure that graduate students get some of these skills. But also that only leaves about 100,000, 90,000 for things like mail and photocopying. So I'm limited by that. I have purchased a software product that allows me to do automatic digitizing of paper surveys, so I wouldn't have to waste money and resources on data entry. So I've invested in that piece of infrastructure, which allows me to do as many paper surveys as possible, and I can do it quickly and easily. So I'm very comfortable saying to anybody on this call, I'll just pick on, I don't know, on Richard. If you're representing a county that you think wants to get involved in, by all means, reach out, because I have the capability of doing that. Surveys are able to be tailored. And what I mean by that is, originally we were going to include Bruce Gray in this, but the sector is so significantly different in those two counties, particularly around the nuclear facility, that I thought, let's just make sure I can do this correctly before we expand. So we'd have to adjust the surveys to make sure they're reflective, because you have to make sure that if you want me to take your survey, I need to be able to see myself in that survey. So I would work with Richard to keep going on this pick, that to make sure it's representative of that local region. And then I'm completely comfortable expanding. We got the green light to expand across the territory of the Yukon. So they're going to do it, and they need some data specifically around housing. So we're able to get that housing data that they need, but then build in some of these questions that we want. And then I would say I'm very, very optimistic that it'll go across rural Alberta. The Canadian Mental Health Association for Alberta and I have had a lot of conversations about this, and I hold my first provincial workshop at the beginning of May. So yes, I am game to expand. I think this is an opportunity for individuals, businesses, residents, governments who are interested in rural, and to make sure you have some sort of voice in your own policy decisions to say, hey, you know what, provincial government, that actually is a great policy for Toronto, but that does not help me when I live in Orangeville or wherever it might be. You're able, but these casual conversations that everyone is having, they're great, but without the data to back up those conversations, it's really difficult to make the argument that you need to be given a little bit of, consideration. So that's what I'm trying to do, provide the data to allow organizations to do that.
So do they just email you, Leith? How do they?
Sure. I mean, I'm I'm kind of ridiculous. I put my personal cell phone number on every survey.
Yeah. Why don't you type your number or your email in the chat?
Yeah, I'll put that in there.
Yeah, and I'm gonna start. I've scrolled through a little bit. So you've got a couple of questions in there. So going to start with a comment from John about should there be a differentiation of rural versus northern, and as a grown up north, I guess, but north rural versus north urban. I'm not sure whether the question is in terms of the results or whether if it's about the design of the survey. So maybe you want to speak to.
So I think I want to be really clear. I think you said it was John that asked that question. Yeah. I'm not from Northern Ontario. I'm from North Bay, and I'm super aware that's central. Like Northern Ontario is remote, and so I'm not claiming that bucket. However, for political boundaries, I am in Northern Ontario, and I think some of the limitations that the North faces overlap with those of rural and remote communities in the South. So access, broadband is still a big issue. Even around here, I live in Fergus, like I mentioned, and broadband is not widespread. Everyone doesn't necessarily have it. My parents live in just outside of North Bay, as I mentioned, and my mom actually just called to say that they now have, I think she said 3.2 downloading gigabytes or something of internet access to their house, which is by all intents and purposes terrible, and they cannot get better internet. So there are some overlapping issues that I think resonate across both, but particularly concerns for Indigenous communities have to be taken into consideration if you're getting into the far north. So there would be some caveats, but I think there's a lot of similarities that could help each other for sure.
So, I'm making some assumptions about what was driving this question, but I mean, would you change the survey design, or are you insisting that the survey questions be the same across every geography so you can compare them?
So some of them would be similar because I want to be able to do some comparisons for sure. But there is a need to recognize, like I mentioned, things like sectors. So if I do Bruce, for example, the nuclear facility has to be kind of its own little caveat. If you get into questions around housing, then I think there's a need to make sure they're reflective of the local population. So there's definitely some flexibility that's possible. And that's why I would want to work, and that's why I have to work, I suppose, with local representatives to make sure that the questions are good, like that they're relatable and that they're appropriate for each one. So it's not necessarily black and white for sure. There's got to be some flexibility there.
So what I'm hearing is that there would be a mix of standardized questions and custom questions for, particular geographies.
Yeah, and the one that I ran, someone who was involved in it wanted some questions on public transit. Great. Okay. That question could be dropped in definitely some locations.
Okay, good. So we got a bunch more here. And we got about 15 more minutes, I think. So let's start cruising through them. So this one thought here is that many have argued that recessions always hurt women, and that the sort of she-cession and COVID impacts that you're also finding were experienced strongly, by women, and is pointing out though that there's also race and class dimensions, so that so if you were thinking about that and your survey, how important do you think it is to collect class and race data in rural Ontario?
So originally, we had a lot of conversations about including a question on ethnicity, and we ended up opting away from an ethnicity-based question and asking about immigration status. A lot of it had to do with perceptions about xenophobia and ideas related to folks that were non-Caucasian in rural areas, immigration status, personal safety. I can't remember the exact number, but that question would be dropped because like 92 or 93% of people opted not to even respond to it. So we would have to readjust some of these questions. I've had some conversations with Dufferin County already because they definitely want to be part of the expansion, and they have suggested some wording that by the look of it has been taken from Statistics Canada, just to try to get some of those ethnicity numbers. In terms of class, that's a tricky thing other than to get income-based questions, home ownership. And all of those questions are included in the current version of it, and I would like those to continue moving forward.
Right, okay. Here's a, thank you for your work and for presenting this to us. I love the idea of collecting more and more granular data in rural areas. However, as a data scientist, you're obviously aware that survey design and construction plays a key role in obtaining valid, usable data. Those of us working in small towns who might lack expertise in that area, and simply asking the questions we're interested in might not result in good data because of question wording or ordering or other issues. Do you have any recommendations on how people without that expertise on small, non-existent budgets should get started with good data collection? So, solve that problem, Leith, and then.
I mean, that's kind of like the $1 million question, right? Like, how do you get it if you can't? One thing I think is fairly, I don't like to use the word universal, but commonly shared about rural and small communities is the capacity issue. The people or the organizations that exist in those locations that might have the capacity or the ability to do data collection are pulled so thin that they just can't do this. So, I mean, we have all of these conversations about networks and about partnerships. I do really think that a partnership with a local university or a local college can really alleviate some of those concerns. I know that I teach graduate research methods. I have, I think, every year about 12 graduate students that I directly supervise that are always looking for research projects. They're always looking for opportunities to, hone their data skills, try to understand the best way to get it. And then I offer supervision for those students. So graduate students they're not free, but they're very, very affordable usually. And it's a great way to get some data done and give them the opportunity to do some learning as well. I'm always involved arm's length if that's a relationship, but I think just reach out to, if you've got a local college or university that obviously has a planning department, that would be super critical. But if they don't, geography does just tons of wonderful stuff. Sociology usually does tons of stuff. So there's usually some opportunities at local schools.
Right. Okay. There's a follow-up question here, and it does make the same point about connecting with universities and so on. And I guess some people are closer to universities than others. And this person is actually in East Kootenays in BC. So I imagine that their local community college might be a good starting point. I know the community college system in BC is pretty thick on the ground, comparatively speaking. So I'll skip that one because I think in some ways you've already answered it.
And also just last question. If there's somebody, I don't know who asked that question, but if you're looking and if they're like TRU might offer something or one of the smaller schools in the interior, if you don't know anybody, I mean, send me an email. I might know somebody in those schools, or I might know somebody that knows someone to make an introduction, right? So it's worth a shot. Yeah.
And Robin, who posted the question, was also pointing out that, data ownership's an issue for, sort of post-colonial circumstances in many rural areas too, depending on the communities that you're surveying. So
that's something that has to be really that's really critical. So I do go through a full research ethics board, and ownership and data sharing is obviously part of that. I am happy to share any aggregate data with anybody who wants it at this point. As I said, I don't advocate, and I'm not interested in becoming an advocate. I think the people who do that need to get their hands on the data. So I do collect confidential, anonymous, non-identifiable data that I can share as aggregate from local communities, is how that works. And I'm really, really open to that.
Right. So here's another question from Mike Hewitt. So he's raising the issue about data relevance in terms of its currency, like the timing of it, and how to do this on a more ongoing basis, so it also doesn't run into the same sort of dated issues that we get with the census. When we're entering a census year, it's the most out of date that it's going to get, right? So, so is there a way to do this on a more continuous basis and less of a single one-off kind of research?
Yeah, I mean, I think Mike's question is pretty is kind of another major question. How do you get it back? And I think given things like the change in real estate that's happened, particularly since COVID, you've seen a massive shift out of the cities into places like Fergus, places like smaller and rural communities, Orangeville, Caledon, and so forth. There is I don't want to say a tipping point that those populations are reaching a point that they can make some demands, but I think the voice is able to be heard a little bit more. And so if you're able to advocate that this project is useful, it is about securing funding to make sure it's something that can happen more than a one-off. I had a conversation with two folks from the Department of Agriculture and Agri-Food Canada last week, and that was their take home. They're like, we want this project to go forward, but the only way we can get you the funding is if you can demonstrate that it's useful. And the only way you can demonstrate it's useful is by those newspaper articles that I shared at the end, basically things that have worked and the buy-in and questions for Mike and people who are local who could say, no, we need this data, it's critical, it has allowed us to respond or prepare for. That is how this happens. And that's what I'm really trying to do. So by having or giving these talks and answering any phone call, that's what I'm honestly trying to do, to make it so that there's kind of a recognition, I guess, from the provincial, but also I think the federal government, that there is a need to ensure that rural Canadians are kind of at that table. All too often, there's a spokesperson from the rural area. And I mean, thanks, that's great, but I don't know who you're representing with one person. So I think it's really important that it's not just a local spokesperson, it's somebody that has access to data that's been collected representative of rural areas. And they can pull that data, say, this is what we have found, these are the issues. If they're only going to give you one spokesperson, at least make sure that spokesperson has the data to argue for your town, for your community, and for your position. So it is really, Mike, about funding, it's about support and making the case for it. And that's what I'm hoping or trying to do, I suppose.
Okay, so I think I've scrolled through most of the questions that were, or all of the questions that were posted in the chat. There's some complimentary remarks there that you can read later, Leith, if you like.
Thanks.
So, but I certainly thank you for your presentation. And, you know, there's people can find you now with you posted your information there. And I just wanted to say that this webinar it was recorded, and therefore we'll have the file. We'll post it to our Knowledge Center. So for those of you who are on the call today and think there's somebody else in your community that might be intrigued by this, or you need to get a team together to bring Leith to your community, you can also watch the recorded video and send it to a friend and share it with a friend. So I'd invite you to do that, and you know, subscribe to the ROI website where and newsletter where you'd get information like this on an ongoing basis. So Leith, maybe we'll get an update in a couple of months where you're at,
Sure.
if you've got some more data. So stay in touch, and we'll certainly be watching with interest. You know, we're certainly publishing a lot of you know, rural employment data, so we know that some of the impacts of COVID were very sector specific as well. So I'm certainly interested in maybe probing your data to see whether the respondents, you know, in particular sectors were more impacted than other sectors because of that.
So I'm just involved in an unrelated project, but related, funded by the Ministry of Labor, looking at sectoral impacts of COVID in rural areas. So that's with in collaboration with Gateway. And
right. Oh, that's really interesting. So yeah. When do you think you'll have that report done?
It's an 18-month project.
Okay.
We're 2 months in. So
okay.
we're just getting it. Yeah.
Okay, so I gotta wait a little while. Yeah. All right.
That being said, I can pull any data that's been collected by sector quite quickly. So if you want, I mean, when I presented to the OFA, for example, I just presented agricultural data. If you are from economic development, then I'll pull that, you know what I mean? So
yeah.
I can pull data. I can pull data quickly.
Yeah, okay, excellent. That is really responsive and great to hear.
Thank you.
Okay, so so thank you, Leith, and thank you everyone for making time in your day for this chat and this dialogue. Take care, everyone.
Thank you very much.